Hi Dr. Blake, my name is Emily Dunning and this is my head-to-toe assessment video. I'm going to give you a display of my room. Okay, and I'm going to give you a quick mirror view of my camera. Okay, so I'm now entering the room. I'm sanitizing my hands, I'm wiping my stethoscope, and I'm donning gloves. Hi, my name is Emily. I'll be your nurse today performing your assessment. Is that okay?
Yes.
Can you say your name and date of birth?
Trevor, August 11th, 1993.
Okay, and note that I've given the client 5 minutes privacy before we get started to change into his gown, and I have returned. So now we'll start with the general survey. Looking at his initial physical appearance, his age appears to be appropriate for his stated age, and skin color is a normal pink color appropriate for his cultural heritage. Looking at his body structure, his body structure appears to be symmetrical. His extremities appear to have no obvious deformities. His height appears to be appropriate for his age and his cultural heritage, and his nutrition appears to be fit and well fed. For his behavior, his expression appears to be content. His mood, how are you feeling today?
Good.
Okay, so his mood and his expression is in line with his mood, and his speech is clear and understandable. He maintains eye contact when speaking, and his clothing appears to be appropriate for the weather. It appears to fit, and it appears to be clean. So moving on from that, we're looking at gait. So if you can walk towards me and walk back. So gait appears to be smooth and even, and there are symmetrical opposing arm swings with movement, which is normal. And so for works of breath, there appears to be no signs of distress. And can you state your name?
Trevor.
The date?
April 4th, 2021.
And where we are?
Toronto.
Okay, so the client is oriented to person, place, and time, meaning that the client is alert and oriented ×3. So now we will be looking at the head. So the head appears to be normocephalic, which means that it is proportional in size to the body and has a normal head shape. When palpating, the head appears to have no palpable lumps or lesions and no tenderness. For the hair, it appears to be a normal brown color. It's smooth texture, and it's evenly distributed. And when looking, there are no obvious infestations. Looking at the face appears to be symmetrical. There is no involuntary movements, and the face is a normal pink color. Upon palpation, there's no apparent edema. Moving on from that, we're doing the cranial nerve number 7, the facial nerve. So if you can smile, show your teeth. Can you frown? Raise your eyebrows. Shut your eyes tightly, and puff out your cheeks. So the patient's able to do all these actions symmetrically, meaning that the cranial nerve is intact. Moving on from that, we'll be looking at the eyes. So the eyelashes have an even distribution. Can you close your eyes, open your eyes, and look up and down? So there's no apparent lid lag. The eyebrows, can you raise them, lower them? So the eyebrows are symmetrical at rest and with movement. And for the sclera, can you open your eyes and look up? The blood vessels, there's a normal amount of blood vessels present. And the conjunctiva, there is no apparent discharge, so this is good. For the ocular motor nerve, so the cranial nerve number 3, we are looking at, you're using prolapse, so the left pupil is 5 millimeters, the right pupil is 5 millimeters, so it's equal and round. And we're testing for direct and light consensual reflex. So direct and consensual light reflex is present as the pupils constrict when exposed to light, and that means that the pupils are reactive to light. And for accommodation, if you can look here, so the pupils converge, meaning that accommodation is present, the cranial nerve is intact. Moving on from there, we are looking at the ears. So I'm just looking at the ears, they appear to be symmetrical, there's no discharge present, and upon palpation of the auricle and the tragus, do you feel any pain?
No.
Upon auricle and tragus, do you feel any pain? So there is no pain or tenderness. Now we'll perform the whisper test, so 3 blue, 2.
3 blue, 2.
Okay, and 5 red, 4.
5 red, 4.
So the patient was able to state back what it was said, meaning that there's no apparent hearing loss. Moving on from that, we are looking at the nose. So the nose and the septum are midline. There's no apparent discharge or crusting. For the sinuses, do you feel any pain?
No.
Do you feel any pain?
No.
So the frontal and the maxillary sinuses, there is no apparent pain or only mild pressure. Now we will be looking at the mouth. So the lips appear to be a normal pink color, no lesions. The gums appear to be a normal pink color, no swelling or bleeding. All the teeth are present. There are no apparent caries. The soft palate is a normal pink color, no lesions. And if you can stick out your tongue and touch the roof of your mouth. The tongue is a normal pink color, no lesions. We will now test for cranial nerve number 9, the glossopharyngeal, and cranial nerve number 10, the vagus nerve. So if you can stick out your tongue and say, ah. So the uvula and the soft palate raise when the patient does that, meaning that the nerve is intact. And now we'll test for cranial nerve number 12, the hypoglossal nerve. So can you stick out your tongue, move it side to side, and say light, tight, dynamite.
Light, tight, dynamite.
So the tongue is midline, lateral deviation is symmetrical, and the patient is able to pronounce those words clearly and distinctly, meaning that the nerve is intact. So moving on from that, we will be looking at the neck. So the neck appears to be symmetrical. The skin is a normal pink color. There are no apparent lesions or scars. And upon palpation, the tracheus or the trachea is in normal position, no deviation, and there's no obvious thyroid enlargement. Now, we would hold here for 1 minute and hold here for 1 minute for the carotid pulses. The rate is 70 beats per minute. The rhythm is normal, and the grade is a +2 grade, which is normal. And then we're testing the cranial nerve number 11, the spinal accessory nerve. If you rotate your head towards my hand, and shrug your shoulders. Okay, so the patient was able to do the following actions against resistance, meaning that the nerve is intact. So moving on from there, we are looking at the upper extremities. The arms appear to be symmetrical. The skin is a normal pink color. There are no visible deformities, and there are no involuntary movements. The hair distribution is normal and even. Now I palpate. So upon palpation, there appears to be no edema or tenderness. For temperature of the skin and the joints, it's a mild temperature and it's equal bilaterally, which is normal. And for turgor is normal on both sides, so the skin retracts to its normal position immediately, which is normal. Moving on from that, we're doing the capillary refill check. So the skin, or the color, returns to normal within a few seconds, which is normal. And now we're doing the radial pulses. So I can hold here for 1 minute. The rate is 70 beats per minute. The rhythm is normal, and it's equal bilaterally. For the brachial pulses, I would hold here for 1 minute. The rate is 70 beats per minute. The rhythm is normal, and it's equal bilaterally. So now we're looking at the legs. If you can lie down. So the legs appear to be symmetrical bilaterally. The skin is a normal pink color, hair distribution is even. There's no obvious deformities or involuntary movements. So now I will palpate. So upon palpation, there's no palpable tenderness. The temperature of the skin and joints is mildly warm and equal bilaterally, which is normal, and the skin returns to normal, and turgor is therefore normal. Now we do a quick capillary refill check of the toenails, and the color returns to normal within a few seconds, which is normal. And now we will check the posterior tibialis pulses. So I would hold here for 1 minute simultaneously, and the amplitude is strong and it's equal bilaterally. For the dorsalis pedis pulses, I would hold here for 1 minute. The amplitude is strong and it's equal bilaterally. So that is normal. Now, if you can sit up and face the back, I will be looking at the thorax and lungs. So the thorax upon inspection is symmetrical. It's a normal ellipsis shape. There's no obvious skeletal deformities, and there's no obvious scars or lesions. Now we will look at an APT ratio. So if you can, turn to the side. So the anterior posterior is smaller than the transverse diameter, meaning that the ratio is a 1:2 ratio and is normal. And now we will palpate the thorax. So I'm just going down. So upon palpation, there's no obvious tenderness. The moisture is dry, which is normal, and the temperature of the thorax is mildly warm, which is normal, and there were no palpable masses, which is good. So now we will percuss. So I'm just... So note that I continue down all 9 locations of reference to compare both sides, and the resonance is a normal low pitch. It's clear and hollow, which is normal. And now for percussion, for oscillation. Breathe in. So note that I heard normal vesicular breath sounds throughout. The rate was 15 breaths per minute, which is normal. The rhythm was normal. I heard no advantageous breath sounds, and the quality was deep, which is good. So moving on from that, we will be doing the heart. So if you can turn facing forward. So I'm just going to map this out. So we start off on the right side. We move down to the second intraclavicular space. This here is where we would hear the atrial valve area. If we move to the second clavicular space on the left-hand side, we are at the pulmonary valve area. And this is where you typically, along the sternal border, is where you typically hear the S2 sound, so it's the base of the heart. Moving one more down, we have Erb's point, and then moving 2 more down to the 5th intercostal space, we have the tricuspid valve area. And then if we move along to the mid-clavicular line on the 5th intercostal space, we hear the mitral valve area, which is also known as the apex, where you hear the S1 sound loudest, and also the apical pulse. So we'll stay here for 1 minute, and the rate is 70 beats per minute. The rhythm is normal, and I hear no extra heart sounds, which is good. So now we will be looking at the abdomen. So if you can lie down, I'm going to drape the patient accordingly. Okay, so we're going to move this forward. Okay, so the abdomen, upon viewing from a horizontal level, it appears to be flat. The hair distribution is appropriate for his sex, looking like a triangle, and the aortic pulsations are visible. The umbilicus is midline, and the symmetry upon breathing, can you take a deep breath, is equal bilaterally. Okay, now for osculating, I'm listening to the lower left quadrant. I would stay here for 1 to 5 minutes. Listening to the upper right quadrant, I would listen here for 1 to 5 minutes. The right or the left upper quadrant, listen here for 1 to 5 minutes, and down here at the lower left quadrant, I listen here for 1 to 5 minutes. Throughout the frequency was around 15 bowel sounds per minute, which is normal and within range. And the character was high-pitched, gurgling, and cascading, which is normal. So now we will percuss for timpani. So we're working in a Z pattern. So with percussion, I noted timpani throughout with only slight dullness in the upper right quadrant where the liver is, which is normal. And now we will perform light palpation. So the client displays no guarding or rigidity, which is normal. So now we will do the musculoskeletal system. Okay, so I'm going to get you to extend your hands. You are going to flex your fingers, extend your fingers, flex your wrists, extend your wrists. We're going to do ulnar deviation, radial deviation, and then we're going to do our elbows. So we're going to extend, flex, and then we're going to do supination, pronation, and then for shoulders we're going to do abduction, adduction, and then we're going to do grip strength. External rotation, internal rotation, grip strength. So strength is strong and equal bilaterally. And then for our legs, if you can lie down all the way up here. So I'm going to get you to flex your feet against my hands and then point your feet against my hands. So this was dorsiflexion, plantar flexion. The client appeared, did you have any pain?
No.
Okay. So the client stated no pain. There was no crepitation and there was no apparent altered range of motion. Strength is equal bilaterally and strong. Thank you.